Becca was kind and loving. She made everyone around her feel special. Truly, she was a wonderful person.
Becca Schmill was the light of her mother's life, a young girl who cared deeply for her family and the world around her.
We went to Honduras together when she was 14. We went with a medical brigade, and I think that experience alone it really touched her so deeply to be around people who don't have access to the things that we have access to.
Then Becca's world was turned upside down.
When she was 15, she was raped, and that led to a downward spiral for her. She began to drink. She was then cyberbullied. Eventually, she turned to drugs to help ease the pain.
But she had no idea just how easy it is for teens to get their hands on deadly drugs.
She was connecting with people, with drug dealers, on social media, and then arranging to meet them. Sometimes it was just down the street from us. And she could get just about anything.
After one relapse, Deb took Becca to Maine, hoping to keep her safe.
While we were there, she was able to find drugs. And the drugs were laced with fentanyl. And all it takes is a very little bit to kill someone. And it killed her.
That was September of 2020, and new research shows Becca's death is part of an alarming trend. Adolescent overdose deaths spiked a staggering 94% from 2019 to 2020, and another 20% last year. In 2021, 77% of all teen overdose deaths involved fentanyl.
I've lost a few patients to fentanyl overdoses in recent years, and it's heartbreaking.
Dr. Scott Hadlin is the chief of adolescent medicine at Mass General Hospital for Children. He says this new research is alarming but not surprising.
It completely matches up to what we're seeing on the front lines right now, that we have a youth mental health crisis on our hands. We're seeing sky-high rates of depression, anxiety, and eating disorders have really skyrocketed as well. And that's also been reflected in what we see with youth struggling with substance use.
Perhaps as frightening, Dr. Hadlin says, when it comes to fentanyl, teens are not seeking out that drug. Traffickers are using it in place of other illicit drugs, from heroin to pills.
People don't know what it is that they're using in many cases.
If you get it on the black market, it could be laced with fentanyl and you can die.
The idea that kids, anyone, doesn't get a second chance with fentanyl.
Right. That's exactly right.
Deb and her family launched the Becca Schmill Foundation to raise awareness about the need to address youth substance use, trauma, and cyberbullying, all in the hopes of helping someone else in Becca's name.
I mostly think of how unfair it was. It all is.
And what did the world lose when we lost Becca?
They lost a bright light. They lost someone who was going to do good, who was going to help other people. I have no doubt of that.
And part of Becca's mother's mission now is expanding treatment that's specifically targeted for young people, something she says they struggled to find for Becca. Now, Dr. Hadlin says the single most important thing parents can do is talk openly with your teenagers, especially about the current dangers of fentanyl. In the newsroom, Karen Anderson, 5 Investigates.